Well, thank you, and good afternoon, everyone. I'd like to thank Minister of Seniors and Housing, Josephine Pon, and Jennifer McCue, the Board Chair of the Alberta Continuing Care Association, for joining us this afternoon. Today, I'm pleased to share a major announcement of new funding to protect folks in continuing care from long-term care to DSL, or Designated Supportive Living, and as well as residents in our seniors lodges in this province. Now, these residents are at the highest risk from COVID-19, and the operators of these facilities have been doing their best to protect them. But the operators have rightly raised concerns about the costs of complying with public health orders that we've put in place. So today I'm announcing funding of more than $14 million per month, or $170 million per year, to these operators. This funding, and this is important, will be retroactive to March 15th of this year. It will cover enhanced staffing, as well as costs for cleaning supplies and loss of accommodation revenue due to vacant beds and rent freezes. And it's going to be maintained throughout all stages of Alberta's relaunch until the public health orders are lifted and the threat of COVID-19 is passed. More than 70% of COVID-19 deaths in this province are in our continuing care facilities. The reality is that these residents are vulnerable to the pandemic, and they'll continue to be until there is an effective vaccine to be found. And it's essential that we ensure these facilities have the tools and they have the resources that they need to protect their residents and their staff. Funding for extra staffing will support frontline staff, including RNs, registered nurses, LPNs, and as well our healthcare aides, or HCAs. And it will help augment staffing levels when healthcare workers are sick or self-isolating. Now, I should note, this new funding announced today is on top of the previously announced funding to increase healthcare aid staff levels and to top up their wages by $2 an hour. Operators received $12.4 million last week. The wage top-up is retroactive to April 20th of this year, and the healthcare aides should see the top-up in their next pay period. This funding increase is the right thing to do for vulnerable seniors, and it's also a critical part of our relaunch strategy in Alberta. We need to get Albertans back to work and enjoying this province, but in order to do that safely, we need to protect the people who are the most at risk. I'm very much aware of the toll that COVID has taken on staff and residents at these facilities and their families. And our government is committed to doing everything that we can to help. I'd like now to invite Minister of Seniors and Housing, Josephine Pon, to the podium to say a few words. Thank you.
Thank you, Minister. Good afternoon. Throughout this emergency, we have been working closely with 150 seniors lodge operators across the province. They are doing an excellent job of supporting and protecting the senior in their facility during this time. But they have made it clear additional resources are needed in order to comply with the need of the new health orders. I'm pleased to announce we will be given $2.9 million a month and total of $35 million approximately a year to all the senior lodge operator to meet the extra needs for all the different facility and the PPE for that during this COVID-19. They have had to meet the needs for increasing staffing and enhance the cleaning procedure, and also the use of the more supplies. Today's funding is another important part of a ring of defense our government is building around seniors. It will go toward maintaining the strong restrictions, preventions of measures, and protocol in place to protect our seniors throughout all stages of the relaunch. And it will ensure we are doing what we can to support and protect Alberta's most at-risk senior from the effect of COVID-19. Thank you.
Good afternoon. On behalf of the Alberta Continuing Care Association, I would like to thank Premier Kenney and Minister Shandro for today's announcement of funding support. The ACCA represents operators providing care and services for seniors and persons with disabilities across the continuum of care, including home care, supportive living, and long-term care. Our members operate about 48% of the supportive living and long-term care capacity in Alberta. Our focus from the day the pandemic was declared has been to keep residents and employees safe, to create environments that support residents' quality of life in times of physical distancing by delivering creative programming which includes keeping residents and families as connected as possible. We are very thankful for our care teams and all that they do to support our residents during this difficult and somewhat confusing time. We also extend thanks to our families and of our residents for their understanding during this time of restricted visitation. We know it has been difficult, and we thank you for your ongoing support. Continuing care operators are facing unprecedented challenges associated with the COVID-19 pandemic. Over the past 2 months, we have been faced with increasing costs associated with augmented staffing, the need for more equipment and supplies to help us respond to health orders, as well as declining revenues related to accommodation fees. This Government of Alberta funding will bring much-needed relief to help offset some of the increased costs associated with operating during the pandemic. As operators, we are responsible for caring for seniors, the most vulnerable demographic of people who are most susceptible to COVID-19. The ACCA is thankful for the open dialogue we have with Alberta Health and Alberta Health Services. We sincerely appreciate their collaboration, support, and guidance as we deal with the many complexities of providing care and services to seniors during the pandemic. Again, thank you to Premier Kenney, Minister Shandro for providing much-needed financial relief to our members. Thank you to Dr. Hinshaw for your ongoing leadership. The government's investment will help us to ensure that we continue to offer the very best care possible across the province. And finally, one more thanks to our frontline staff who work tirelessly every day to keep our residents safe and healthy. Thank you.
Good afternoon. Today, I am pleased to report 5,584 Albertans have recovered from COVID-19, leaving 1,004 active cases in the province. Currently, 61 people are hospitalized with COVID-19, with 8 of those admitted to ICUs. In the last 24 hours, out of 2,428 new test results, there were 33 new cases. I'm pleased to report there are no new deaths today. I want to inform you today of a new positive test result in a resident of Mackenzie Town Long-Term Care. This resident was part of a group who had not previously had tests done and was being tested in a precautionary way, so it is not clear whether this is a new infection with the virus or shedding from a previous mild infection that was not identified earlier. The facility is working closely with Alberta Health Services to understand the implications of this result and what it means for their outbreak. While it is too early to see the full impact of Relaunch, so far our case numbers in the province have held steady. We are not seeing any increase so far in numbers in Calgary and Brooks, and overall, as I mentioned, our cases are stable. We have now received results from just over 3,400 asymptomatic tests done in Calgary. Of these, 430 of those tests were done on close contacts of confirmed cases. And in that group, there were 75 positive results. There were only 48 positive results in the remaining 3,000 people tested, showing that the likelihood of infection is much greater when there is a known exposure. Those who signed up for asymptomatic testing prior to Monday will be offered testing throughout this week. We need to remember that being safe while relaunching the economy can save lives. The virus is still with us, and we must do everything we can to prevent the spread at home, when we are out, and when we are at work. I want to remind you that working remotely where possible is still recommended until stage 2 of our relaunch. For businesses looking for information on how to protect their staff and the public, please consult the workplace guidance on the Alberta BizConnect website. Sector-specific guidance is available, and my team is working hard to develop more of these documents. A template is also available to help employers plan to reduce transmission risk in their businesses. At my last update on Friday, I said this plan was mandatory for businesses that are reopening at this time. After hearing feedback from many stakeholders, we have altered this requirement. Completing the template is now recommended but voluntary for all businesses. I apologize for any confusion this may have caused. We are working to determine the best course of action to keep case numbers low and support businesses in meeting the requirements to prevent spread of disease, while also not placing undue burden on struggling business owners. All businesses must have measures in place to prevent the spread of COVID-19. The planning template is one tool to help them determine what measures are appropriate for their workplace and communicate these measures to their staff and the public in a transparent way. I encourage businesses to use this tool to adapt guidance to their specific context. As we move into Relaunch, we continue to learn more about the virus and about how other parts of the world are responding to this pandemic. I have received many questions about Sweden's approach, where the government put minimal stay-at-home or physical distancing orders in place. Instead, Sweden made recommendations for its people to take these steps wherever possible. I, too, have been following Sweden's experience. There are a few things to note about the impacts they have felt and the differences between Sweden and Alberta. First of all, more than half of all households in Sweden are single-person households. This means that distancing from others in daily life is much easier. In Alberta, less than a quarter of all households have only one person. Secondly, there have been restrictions in Sweden, such as capping gathering sizes at 50 people and closing high schools and post-secondary institutions. In addition, social distancing restrictions have been enforced where needed. For example, some restaurants have been required to close where distancing measures were not followed. Finally, Sweden's advice-based rather than regulatory approach came at some cost. As of yesterday, their toll was 3,698 deaths. That is 36 deaths per 100,000 in their population, which is 12 times Alberta's rate of 3 per 100,000 population. In addition, their ICU admission rate was 18 times Alberta's. For a more complete picture, we have posted a graph that compares the rates of cases and severe outcomes in Sweden and Alberta. You can find this information on the COVID-19 modeling page. Despite Sweden's less stringent approach, their economy has also shrunk in a similar way to neighboring countries who used much more aggressive containment measures. My point is not that there is one right or wrong way to deal with the pandemic, but rather that there are costs to every choice. In Sweden, there has been a cost of higher death rates. In Alberta, as elsewhere around the world, there has been a cost of temporary restrictions on some freedoms. We have not seen a high attack rate or death toll here because Albertans have protected each other by our actions. We continue to learn from the approaches other jurisdictions are taking, and we must continue to protect each other as we move slowly back into opening businesses and some social activities. I want to remind Albertans that public health orders remain in place for that reason, including limiting outdoor gatherings to 50 people or less, and indoor gatherings to 15 people or less, as well as isolating when feeling ill, and maintaining physical distance between ourselves and people outside our household or cohort families. I also encourage you to download the AB Trace Together app to help speed up contact tracing. Last week, AHS identified the first COVID case who had the app, and information from it validated the contact tracing process. The more people who sign up, the more effective this tool will be. These actions continue to be necessary to prevent a surge in cases as we reopen our economy. I know we are all eager to return to normal. But as I have said, even as we resume some normal activities, we are not going back to the way our society was before the pandemic. We are moving forward while continuing to be cautious and taking all necessary steps to protect our most vulnerable family, friends, and neighbours. That is why I'm pleased to hear Minister Shandro's announcement of additional funding for continuing care operators. We need to continue to support the safety of residents and staff at these facilities. They face serious challenges in responding to the COVID-19 pandemic and complying with public health orders. The risk to continuing care residents is very real, and we cannot let up on the measures we're taking to protect them. There is no change to the visitor restrictions currently in place, and family and friends who wish to arrange outdoor visits must call ahead to arrange these. We must all continue to take precautions, staying home when ill, and acting responsibly when resuming some activities as restrictions are slowly lifted. I thank all Albertans for the sacrifices they have made to get us to this point. To continue moving forward, we must take measured steps. We must work together, and we must continue to support each other with kindness and compassion every step of the way. Thank you. We'll be happy to take questions.
All right, we'll go to the phone now. Just a reminder that in addition to Dr. Hinshaw, we have Minister Shandro, Minister Pon, and Jennifer McCue with the ACCA available for questions. Operator, could you put the first one through, please?
First question is Julia Wong with Global News. Go ahead, Julia.
Hi, this question is for Dr. Hinshaw, and maybe if the health minister wants to chime in as well. The Canada-U.S. border will remain closed for another month. How important is this closure, and what would you like to see either in terms of cases, hospitalizations, or screening before that border is reopened?
So the Canada-U.S. border decision is a federal decision, and so certainly that's something that's been discussed on our special advisory calls. We know that the United States, like other countries, is still working to control the spread of disease, and so we have put in place a provincial order to require anyone from any destination internationally to be in quarantine for 14 days after they enter Alberta from outside the country. And that's certainly something that is going to be in place for the near future as, again, we see other countries around the world, including the U.S., having some difficulties with COVID-19 spread. So I don't know, Minister, if you want to add anything to that.
Thank you. I would say this as well, that we have, as Dr. Hinshaw said, we have enhanced screening procedures at the airports, as well as processes at our airports to enhance the plans that folks have to be able to provide to us, not just to the CBSA when they land at the airports, to be able to also provide to our provincial public health folks as well, what their self-isolation plans are going to be. And so those enhanced measures that we put in place at our airports, we will also be soon, I think, being able to execute on at our land border crossings as well. And so this is part of our relaunch strategy for us to be able to have enhanced measures at our airports, our international airports in Edmonton and Calgary, as well as the land border crossings. And I had a good conversation with Minister Haidu, the federal health minister, and she made a commitment to me that from the steps that we've taken as a province to be able to enhance what's happening at our airports and the land border crossing, that they want to work with us and collaborate to make sure that we're working together, so that also when volumes increase at the airports or at the land border crossings, that we're going to be able to work with them to make sure that those enhanced measures won't be backing up some of that traffic. So thank you.
Operator, could you put through the next question, please?
Next is Michael King with Global News. Go ahead, Michael.
Hi there, Dr. Hinshaw. We've heard your recommendations for places of worship when it comes to singing. We're wondering about choirs, like adult choirs, children's choirs, concert bands, marching bands, kind of Alberta's music community. What's your recommendation for them, and when can they get started again?
So singing is an activity that has a higher risk of spreading the virus than simply talking to someone. And so the restrictions that are on religious gatherings with respect to no group singing would apply to choirs as well. And certainly that's something we've been getting questions about then for things like concert bands with brass instruments or wind instruments, whether or not that poses a risk. And we're looking at those questions. I don't have an answer for bands or those who are playing instruments in a group together today. but we are trying to consider how we can use the best evidence available and provide recommendations to those groups. We know that music is an important part of many people's lives, and we want to make sure that we're giving the best evidence-based recommendations for how that can happen safely.
Operator, could you put through the next question, please?
Next is Madeline Smith with the Calgary Herald. Go ahead, Madeline.
Hi there, Dr. Hinshaw. I'm just wondering about the outbreaks that we've seen in some of Calgary's homeless shelters. What's the status of those right now? And in terms of asymptomatic testing of some of the clients that were staying there, were there cases where asymptomatic people were found to have the virus, or was that not an issue in those settings?
So the latest information that I have is that in Alpha House, there are 10 cases that have been identified, 5 of whom have recovered. And in the drop-in center in Calgary, there are another 10 cases, 2 of whom have recovered. And with respect to asymptomatic testing, in both of those locations, there was testing done of all those individuals who could potentially have come into contact with the cases. And there were very few cases that were identified through asymptomatic testing. I'll have to look up the number, but I know for the drop-in center, it was quite a small number, perhaps 2 that were identified through that testing. But we'll verify and get that number back to you. I bet the majority of the cases identified in those settings have had symptoms.
Operator, could you put through the next question, please?
Next is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Dr. Hinshaw. Just a quick question. This morning, the Premier was talking about that there's a decision made Friday on the Calgary Brooks whether or not to go ahead with a full reopening for Phase 1. Now, I know it's early. It's only Tuesday afternoon, but from what you're seeing so far, very preliminarily, what are the chances for Calgary and Brooks to get a green light for a full Phase 1 reopening when you sit down and decide on Friday? How's it looking so far?
So, so far the numbers are good. They're very stable, which is excellent. That's what I would want to see. I think the important thing to remember is that the incubation period is up to 14 days, but the average incubation period is in that 5 to 8 day range. So this week is going to be critical. We know the reopening happened on Thursday last week, and so we'll be able to provide a more accurate understanding of what the impact of that initial phase of opening has been by midweek. And so I expect over the next couple of days, as we see the daily case counts, that's what we're going to be looking to very, very closely. But certainly the numbers to date have been good, and I commend those in Calgary and Brooks who are taking the necessary measures, even as retail businesses have opened and some additional activities have opened, to continue to follow the public health measures to prevent transmission. And also those that have come forward to offer to be tested even though they have no symptoms. That also is going to help us get a better understanding of what kind of infection rate there is in the community. So again, I think the next few days will be critical, but so far the numbers are certainly stable and encouraging.
All right, we've got time for 2 more questions. Operator, could you put the next one through, please?
Next is Kevin Nimick with CTV Calgary. Go ahead, Kevin.
Hi there. This is a question for Minister Shandro. Minister, we learned last week that pharmacists had been sent PPE, and then weeks went by, and they were sent another shipment of PPE from the government, and that second shipment came with a bill. And when their association reached out to your department, they were told they may be billed in the future or they may not be. So can you state for the record, will pharmacists be billed for essential PPE? And why is your department being so unclear about the billing procedure?
Well, thank you. So we are, through our ministry, working with AHS for the procurement of the healthcare facilities, and I know the Provincial Operations Centre has been providing the PPE to everybody else throughout the province, including our allied professionals, including the pharmacists. I would say this, that I think it is unfortunate that the folks have gotten mixed messaging. We'll make it very clear for these pharmacists to understand, and the association as well for the pharmacists, about the situation, about whether or not they're going to be paying for this PPE. I commit that I will work with Minister Madhu and the Provincial Operations Centre to be able to give them a very clear answer on this.
Operator, could you put through the final question, please?
Final question is Tanya Faubert with the Rocky Mountain Outlook. Go ahead, Tanya.
Hi, Dr. Hinshaw. I'm located in the community of Canmore, which is in the Bow Valley, surrounded by provincial parks. Many of the trailheads and amenities here that are popular are within the community's boundaries or on its doorsteps. You've moved from a message of stay at home to stay safe, and I'm wondering what work have you or your team done to assess or mitigate the additional risk residents of Canmore may be at as a result of Albertans, and in particularly Calgary residents, beginning to travel to this community and over the past long weekend, a particularly busy time in this community.
So I think that that question would be something that would be experienced by many residents who are close to Alberta's provincial parks, but also close to campgrounds. And what we've done with respect to the health messaging is make recommendations when people are traveling away from their home community, that they think about stocking up on supplies, whether that's groceries or fueling up their vehicles close to home, so that they're interacting within businesses that are close to where they live. Again, we're in still the early phases of the relaunch, so that messaging is a cautious approach to trying to have people do most of their interacting in those regions where they live, but really wanting to, again, encourage Albertans to take on that responsibility and making sure that they're keeping themselves and each other safe. And so with respect to the enforcement of the distancing measures in provincial parks, that's something that I haven't been told that there were significant issues on the weekend. So that's something I can follow up on and find out if that was something where there were concerns that were seen. But that hasn't been reported to me so far. Certainly, if that's something, there were certain things that were seen in Canmore that the citizens there are concerned about that not being safe, then I would encourage people to report that to either, if it's part of the provincial park system, to Environment and Parks, or if it's something that's happening within the town that they're seeing with respect to businesses perhaps operating in unsafe ways, then Alberta Health Services does have complaints reporting process on their Environmental Public Health website. And there is a link to that complaint reporting process from the alberta.ca COVID website. So if there are specific locations or specific incidents where people are feeling unsafe, then I would encourage people to report those concerns so they can be investigated. But in general, again, with Relaunch, we have to all be in this together. We have to be supporting each other to make the right decisions and reminding each other of the importance for this collective protective effort to keep each other safe.
Thanks for joining us, everyone. The next update with Dr. Hinshaw will be on Thursday afternoon.